Hello, ma'am. I am Eulalia Ford. I'm a first year nursing student. I'm going to take a moment to wash my hands before I shake yours. I'm working with your doctor today. As a student, I will be sharing all your information with the doctor, and she or he will work with you to plan your care. What brings you to the doctor today, ma'am?
I have a sprain.
Was there something else you wanted to speak with the doctor about today, ma'am?
No.
I'm going to start your evaluation by discussing your history. Let me summarize what I just heard. Please correct me if anything is wrong or incomplete. What is your name, ma'am?
Crystal May Piliutas.
How old are you?
21.
Saan po kayo nakatira?
Mabukayan, Balamban.
Why are you here today again, ma'am?
Because I have a sprain.
Could you show me where you are feeling this sprain, ma'am? The pain?
So, dapat kita.
Kung anong dahilan bakit kayo nagkaroon ng ganito?
Naglalakad kasi ako and hindi ko namalayan, may bato pala. Kaya natapilok ako.
Does it seem to go anywhere else?
Yes.
How would you describe this pain, ma'am? On a scale 0 to 10, 0 is equal to no pain. 10 worst pain. You can imagine how would you rate your pain?
8.
When did this problem start, ma'am?
Last 2 weeks.
How long does an episode last?
Last night.
How often do you get this in a day or a week, ma'am?
A week.
Since it started, has it been getting better or worse?
Better.
In what way is it changing?
Hindi na siya masakit.
What were you doing when this problem first started?
Relax.
What makes the problem worse?
Kapag lumalakad.
What makes the problem better?
Chill.
Do you have any other symptoms, ma'am?
No.
Do you think these other symptoms may be related to your pain?
No.
Have you ever had anything like this before?
No.
What worries you about this, ma'am?
What?
What worries you about this? Kasi mga ipang worry ni mo itong nagkaroon ka ng sprain.
Baka hindi na ako makalakad.
How is this affecting you?
Stress.
How does it interfere with your daily activities?
Stress.
How is your ability to do things around the house and nearby? Do you have any difficulty driving, cooking, using your medications?
Yes.
How are you doing with your work? Are you having any problems there? Any problems with your recreation?
No.
Now I'm going to ask you about your medical conditions and health. In general, how would you rate your health?
10.
In necessary provide scale, if I were to give you the following options, excellent, very good, good, fair, or poor, how would you rate your health?
Excellent.
As an adult, what medical conditions have you been told you have?
Nothing.
Hasn't anyone ever told you that you have high blood pressure? What about diabetes?
No.
What mental conditions have you been told you have?
Nothing.
What over-the-counter medications do you use? What do you use that for? What is the dose? How many times a day do you take it?
Nothing.
Do you have vitamins, ma'am?
Yes.
What? So you use that as your vitamins. What is the dose?
2 days.
How many
Take
vitamins do you take in a day?
One. One only.
Do you think it is working?
Yes.
How do you say so?
It's because I am energetic every day.
Do you think you are having any side effects? If yes, tell me about it.
No.
What vitamins or supplements or home remedies do you use?
Multivitamins.
Do you think you are having any side effects?
No.
Are you allergic to anything?
No.
What happens when you are exposed to any medication?
Nothing.
Have you been hospitalized?
No.
Have you ever had surgery?
No.
Have you ever had an accident or injury that needed medical care?
No.
Have you ever had a blood transfusion?
No.
What illnesses do you have as a child? Did you have the chicken pox?
No.
How old were you when you started your periods?
12.
Do you have any problems currently?
No.
Are you still having your periods?
Yes.
How many times have you been pregnant?
No.
Over the past 2 weeks, have you often been bothered by feeling down, depressed, or hopeless?
Sometimes.
Over the past 2 weeks, have you often been bothered by little or no pleasure in doing things?
Sometimes.
Do you regularly have your blood pressure checked? How often do you do that? What were the results?
No.
Do you regularly have your vision checked?
No.
Have you had a tetanus shot in the last 10 years?
No.
Have you had 3 shots for hepatitis B?
Hepatitis? No.
Now I'm going to ask you about your family's health. Has anyone in your family had like cancer or
No.
problem sa health? Tell me about your parents. How old are they?
My mother is Lola Playotas. She's currently living in Bamban and she's 49 years old.
Your father?
Francisco Piliotas, and he is an OFW and he's 52 years old.
How would you describe their health?
It's good.
Tell me about any brothers or sisters you have. How old are each of them? How would you describe each person's health?
Ano?
You can... Isa rin, or usa ka girl, usa ka boy.
Agustin Piliotas.
Was her health is good or...
Good. And Rolly Piliotas, also good.
Do any medical conditions run in your family?
No.
Let me ask you about some specific conditions that are very common. Has anyone in your family been told they have high blood pressure?
Yeah.
What about heart disease?
No.
Now I'm going to ask you about your personal background. How far did you go in school?
Right now, I'm online studying.
Are you in college right now?
Yeah.
What is the highest level of school you have completed, so college? What languages do you speak? Which language do you prefer?
English.
Are you married?
No.
Who do you live with?
My parents.
What type of home do you have? Offer single family home, apartment, or others?
Family. Home.
What do you do for a living?
Studying.
Have you ever been in the military?
No.
Do you feel any of your jobs have high hazards or risks to your health?
No.
Do you have any financial concerns about your home?
No.
Food?
No. Nothing.
Do you use any tobacco products?
No.
Have you used tobacco products in the past?
No.
How much alcohol do you drink?
No, I don't drink.
Have you used alcohol in the past?
Yeah.
Do you use any other recreational drugs?
No.
Have you used drugs in the past?
No.
Have you been sexually active in the past?
No.
Are you currently sexually active?
No.
Tell me about your diet. Do you follow a special diet?
I don't do that.
What do you do for leisure or to relax?
Exercise.
What do you do for physical activity or exercise?
Push-ups.
How often?
Mm,
Twice a day?
Twice. Yeah.
Twice a week?
Twice a week.
Do you feel safe in your relationships?
Yeah.
Has anyone physically hurt you?
No.
Do you have someone who can help you if you are physically ill or emotionally upset?
Yes.
How does religion or spirituality influence your healthcare? Like sa mga mga gipang tuo sa mga Bisaya, like mga tuo ba na
Yes.
it's really help you?
Yes, yes.
How often do you wear a seatbelt? How often do you use sunscreen?
Every day.
Do you have any weapons in the house? What type do you keep this locked up or out in children's reach? You have a
Knife?
gun?
A gun?
Knife?
No. It's a knife.
Do you have a living will?
Like motor?
Like a written statement about your healthcare wishes?
No.
Have you designated someone to make healthcare decisions for you if you are unable to do so? Thank you, Mom, for your cooperation. You can leave the room and then present the findings.
Thank you.